Good morning. So for this video, we will going to discuss all about bone scintigraphy, including the anatomy and physiology of the bone, the indication and contraindication of the study, the patient preparation for the procedure, the radiopharmaceuticals used, the instrumentation, and finding. So, without further ado, let's get into it. So before we proceed to the anatomy and physiology of the bone, let us first know what bone scintigraphy really is. Bone scintigraphy is a nuclear imaging test that is used to diagnose and to keep track of several bone disease. It also involves the utilization of a radiopharmaceutical. This test is very sensitive to any difference in bone metabolism, and the ability to scan the entire skeleton makes the bone scintigraphy very helpful in diagnosing a wide range of bone disorders. So for the general anatomy of the skeletal system, it is divided into two parts, namely the axial skeleton and the appendicular skeleton. In axial skeleton, it contains 80 bones, wherein in the appendicular skeleton contains 126 bone. The outer portion of the bone is composed of the compact bone, and the inner portion, termed the medullary canal, is made up of cancellous bone. Bone marrow is located within the medullary canal, and it is interspersed between the trabecula. This intricate web-like bony structure is visible on the properly exposed radiograph of the skeletal system and is often referred to as the trabecular pattern. For the diaphysis, it refers to the shaft portion, and it is regarded as the primary site of the ossification, whereas the epiphysis refers to the expanded end portion and is the secondary site of ossification. It is not included in the slide, but we will going to discuss what is about metaphysis. Metaphysis refers to the growth zone between the epiphysis and the diaphysis. It's the area of the greatest metabolic activity in the bone. Bone is an organ, but it is also a type of connective tissue. However, it differs from the other type of connective tissue because it composed of a matrix of calcium phosphate. So the bone has six major functions. That is for support, movement, protection, production of blood cell, storage of minerals, and endocrine regulation. Bone scintigraphy is typically employed on patient who has a condition or illnesses that involves their bone, such as the fracture, Paget disease, osteomyelitis, and the like. Bone scintigraphy is contraindicated on pregnant patients. That is because bone scintigraphy uses ionizing radiation, which is in the form of gamma ray. And this gamma ray poses a threat on the fetus itself. Therefore, in order to avoid that risk, bone scintigraphy is not employed on pregnant patients. Patients do not require any special preparation. They can eat what they want, they can drink what they want, they can take their medication as usual. However, patients are encouraged to drink additional fluid over the duration of the procedure if possible. And the patient needs to be informed that bone scintigraphy will take by approximately 4 hours. And if the patient experiences pain during the duration of the procedure, a pain relief might be administered to the patient itself to alleviate the pain that is being experienced by the patient itself. Radiopharmaceutical is a compound that is a combination of a radionuclide and a pharmaceutical. The two common radionuclide that is being used in bone scintigraphy is the technetium-99M MDP and the fluorine-18 NAF. So the technetium-99M MDP is a combination of a radionuclide which is the technetium-99M and a pharmaceutical MDP, or also known as the bendronic acid. For the fluorine-18 NAF, it is a combination of the radionuclide fluorine-18 and a pharmaceutical known as the sodium fluoride. Gamma cameras, PET scanners. These are the instruments used to image the radioactive decay from the radio tracers utilized in bone scintigraphy. Bone scintigraphy can give many benefits to the patient. First is that it can detect early bone cancer. It can also determine the extent of the spread of the bone cancer to the other part of the body. It can also detect other pathological condition that involves the bone, and it also helps the doctor to monitor the effects of treatment on bone abnormalities. So that is the content of my video presentation in regards to bone scintigraphy. I hope that you have learned something, and thank you very much for listening.